All right, good evening, everyone. Welcome again. Thank you so much for joining us here at the Halifax SDA Church. It is my pleasure, my privilege, my joy to be here with you to share one more time things related to health, healing, and restoration. His healing love. We definitely need that. And I know that all of us, we need healing physically, mentally, and spiritually as well. And we also want to include the emotions as well. And so this evening, I'm so happy that I'm here again to share with you. And I hope that you are taking the things you're learning and putting them in practice. I like how Ben said it today. He went and he did his checklist to make sure he was putting things in practice. And that's a good way to go about it. You know, when we learn something and we put it into practice instantly, it's easy for us to continue to do it than if we delay. So glad to hear that from you, Ben. And I'm happy for you that you have started to implement something. And I hope others will post as well that they have started too. All right, this evening, I want to get right into our presentation because there's a lot to talk about, but there's not as much time to talk about everything. But what we have time for, we're going to definitely speak about some of these things. Now, I want to say that this is one of the most important topics that I like to present on because I have found that it is so vital for optimal health. And why do I say that? Simply because I have seen over the years why this topic is important. So, our topic is going to be this evening the missing ingredient for your health. So, here we go. As we get into this now, I want to just share with you just a quick disclaimer that the information received in this presentation is for general information purposes only and is not intended to replace medical advice or treatment. Before making any lifestyle changes, it is advised that you contact your health care provider. All right, so now that we have cleared that out the way, let's get into our topic the missing ingredient for your health. What could that be? I'm sure you're probably thinking already, I wonder what that it could be. What could be one of the missing ingredient for my health? Now, let me tell you about this. Over the years in doing the work that I do as a lifestyle coach, I have observed that this has been one of the biggest thing when it is missing that is affecting people's health. And this is as far as Florida, all the way up here to Halifax, to elsewhere in Canada. I have found the same thing over and over again. There is just an issue with this thing. And many times after a presentation like this, persons are like, wow, I didn't recognize how important this is. And so this evening, we are getting right into this again. And I want to share this with you. What is the missing ingredient of many of us health? All right, have you made a guess already? Do you want to know what it is? All right, well, here we go. One of the missing ingredient for health, from my perspective, that I believe is the issue of sunlight. I hope you can see that on the screen. I understand we have a little bit of delay between what I'm saying here and what's projected there, but I hope you can follow along with us. We could make some arrangement to make sure you get the information in succinct order. But here's what happened. Why do I say sunlight is a missing ingredient for health? Don't we get sunlight? Oh, yeah, we do get sunlight. But there is something you need to know about sunlight. And I'm going to expose this thing here today. We're going to lift the lid off this because I want you to understand something important. Now, let's go do a little backup here. Now, let's take a look from the creation story, which is pretty much similar among Christians, Jews, and in some cases, Muslim. Did you know that we have similar creation story in the sense that it all begins by saying that in the beginning, God created the heavens and the earth, and one of the first thing that he made, watch this now, was light. Now, follow me now. There is absolutely nothing that can live and survive without the impact or influence of light. To have life, you need light, and it is very important. And that is why you will find that if things don't get proper light, they could die for the most part. If not, that thing has some influence from something else that needs light. To have life, we need light. Sunlight is vital for optimal health. Let's explore. Sunlight does more than just keeping us alive. Actually, one of the biggest thing about sunlight is regarding vitamin D production. That is one of the biggest benefits of sunlight, vitamin D production. So interchangeably, you may hear me use vitamin D, sunlight, but bear with me as we go along. You understand what exactly I'm talking about when and which one it is pertaining to. Now, follow me now. When sunlight hits the skin, it converts cholesterol under the skin into pre-vitamin D. This is now carried to the liver and it undergoes a process of hydrolyzation. Then it goes to the kidney that activates it into a substance to form the active vitamin D. So follow me now. In order for you as an individual to make vitamin D from the sun, number one, you got to be out in the sun. The second thing is you want to ensure that once you're out in the sun and you get that D, without anything blocking that, we're going to talk about that later. Here's what happened. A proper functioning liver and a proper functioning kidney is also vital for you to be able to utilize that vitamin D from the sun that your body can make. So here's the thing. Get out in the sun is important. Now, what are the effects of vitamin D in the body? Now, here are some of the effects of vitamin D in the body. Vitamin D actually helps to stimulate insulin secretion. That is good for diabetics, right? It also resets the biological and circadian rhythm, and it also boosts the immune system. It has anti-cancer properties, antibacterial and antiviral agents as well. It helps with muscle mass and strength. It strengthens the bone. And once your vitamin D level is about 75 nanomoles per liter, it helps with calcium absorption. So sunlight, vital, vitamin D, which is made from sunlight, is absolutely essential. Let's move on. In fact, one researcher shows that over 1 million people die every year from a lack of sun exposure. It is a pandemic that involves both adults and children. So let me tell you, children are turning up with severe vitamin D deficiency. Adults have it, the aged have it, young have it. Let me tell you, it's a big issue. Now, follow me now. Listen what it says here. Dr. Michael Holick from Boston University School of Medicine says this, that it is estimated that about 1.5 billion to 2 billion people worldwide are vitamin D deficient. Now think about this. The world has just over 7 million people. Billion people, that is 7 billion people. And if 1 billion to 1.5 billion, of people are vitamin D deficient, now that is like 1 in 7. So out of every 7%, there is one that is vitamin D deficient. And by now, because this was 2010, it is possible that it could be worse. And you're going to see why I'm saying this. So what increases my risk for vitamin D deficiency? What is it that affects that? And what could lead to that issue? Now, we're going to explore something. So if you live in northern latitudes, that is anywhere from Los Angeles, California, over to Colombia, the tip of Georgia, anything north of that. And the further north you go, the greater the risk of vitamin D deficiency is going to be for you. Now, I found something even more interesting, and that is, and I hope you can see this with me, and that is when it comes to sunlight, there is a sunshine calendar. If you don't see it now, Google it, sunshine calendar. you'll be amazed to see where we are in Canada, and you will recognize that where you are there in Halifax and so on, that there are only but a few months out of the year that you can really make vitamin D from the sun. And so you will recognize that the best time you have is between May, June, July, August. By the time September comes around, things are getting dim for you. And it all depends where in Canada you are. So, what am I trying to say? Pretty much more than 6 months, or close to 6 months, some places out of the year, we're not able to make adequate vitamin D, or in sometimes no vitamin D at all from the sun. So, why is this important? Now, I want to let you know right now that for the years, over 10 years that I've been working with individuals, I have found that even people from all the way down Miami, Florida, all the way here to Canada, I have found that most people that I've recommended check out their doctor, their vitamin D level. I can tell you this unequivocally that all of them have always come back and said they are vitamin D deficient. So that is why I said, no, if this is something, not one, not 10 people, not 20, not 100, not 200, not 500, lots of people that I've worked with over the years, and if they're gone to do the test, always deficient. That tells me something, that even people in Florida, even though they have the sun all year round, as it were, let me tell you, if you don't go in the sun and if you don't spend the right amount of time and don't go the correct time, then what you're going to find, you're going to have deficiency. So I hope you're following me here, because this is vital information. Now, how does vitamin D deficiency affect my body? That is very important to understand. How does that affect my body? Recent research shows association between vitamin D deficiency and several medical conditions. What are some of these conditions? Vitamin D and the big C. Let me tell you, vitamin D deficiency is a known cause for cancer. So follow this now. Breast cancer risk increases with vitamin D deficiency. I want to let you know something here, and that is, I've never worked with a woman who has breast cancer or a man who has prostate issue. I've never worked with either of these groups or share any information lifestyle related with such who were not vitamin D deficient. Every one of them, breast cancer, prostate cancer, always vitamin D deficient. Now, and how do I know this? We just simply ask them to do a test at the doctor. And when they get the results, it's always showing low. Now, women, there says one study shows in the American Journal of Clinical Nutrition says that just about for women who are vitamin D deficient has a 600% risk of breast cancer. That is what the research shows, which is something very interesting. Now, when you think about that, being vitamin D deficient increases your risk for breast cancer, according to this study, by 600%. That is something to take a look into, because let me tell you, breast cancer is on a rise. And here is what the problem is right now. Because of a pandemic that we are in, you're finding that many persons are not getting the type of care that they would normally get. Things are not getting diagnosed as fast as they should. And this is going to create a plethora of issues later on. So hear me out now. What I want to encourage is this, that women, if you reach a certain age, over 40, over 50, make sure, well, here's what, let me not even put an age to it. Anyone that is listening out there, you ask your doctor to get a vitamin D test. But let me warn you from now, you may find it challenging to get a test. Why? Because most times I've realized that doctors, they will tell you, you know what, I can't do that test for you because it's not covered by the health program here. So what I would encourage you to do is to let the doctor know that you will pay for it yourself, and most times they will allow you to do it, but they're very reluctant oftentimes to do that. Anyway, we're going to continue here. We're talking about sunlight and cancer. Let's go. Vitamin D deficiency doubles the risk of cancer. Now think about that. Vitamin D deficiency doubles the risk of cancer. Women are vitamin D deficient, according to another study here, have a 222% risk of developing breast cancer. Watch this now. The cancers most strongly linked to low levels of vitamin D are breast cancer, colon cancer, lung cancer, and prostate cancer. Like I shared with you before, when it comes to breast, lung, colon, and prostate cancer, all the time, if I have to talk with, work with, or guide someone in this process here, always vitamin D deficient. I've never seen one that has not been. All right. So keep this in mind. Studies have shown also in the Physicians Health Study from Johns Hopkins Health Alerts, the study shows that when it comes to prostate cancer, that men in Florida have a lower rate of cancer, but as they move further north, they find where sun is less, they are finding that there are more prostate cancer rates that are developing, that they are seeing. Now, let me share with you some links of diseases that could arise from vitamin D deficiency. Now, vitamin D, sunlight deficiency in the same nutshell, but because we get vitamin D from the sun, I keep using that word. Now, here's what happened. I'm sharing with you some diseases here, but this by no means is an exhaustive list. So follow me now. Here's some of the diseases: osteoporosis, rickets, asthma, dementia, anemia. Let me tell you, whoa, I wish I had time to get into anemia, but you know what? Let me not get too excited here. I'll just move along. Hypertension, obesity, cancers, over 18 different types of cancer can come as a result of vitamin D deficiency. Things such as prostate cancer, breast cancer, colon, colorectal cancer, multiple myeloma, eye cancer, pancreatic cancer, liver cancer, ovarian cancer, endometrial, and lung cancer as well. Those are some of the cancers that you can get. And you know, one of the things I've recognized, one of the cancer that is on a quick rise is actually thyroid cancer. For some reason, I'm finding that there are quite a few people that are coming down with thyroid cancer. Now, let me tell you, the nice thing about living over there in Nova Scotia, where you are, is that you have some of the best kelp and dulse and these kind of things that one can get out there. And here's the thing: you can go ahead and you can use the kelp, use the dulse. Those are things that can actually help you with nourishing your thyroid as well. Anyway, let's proceed here. Other diseases that can come as a result of vitamin D deficiency are epilepsy, anaphylaxis, insomnia, tuberculosis, schizophrenia, diabetes, anemia, anemia, autism as well. All right, we've moved along a little bit further there. Autoimmune diseases and also multiple sclerosis. Now, let me talk about autoimmune diseases for just a little bit. When we're talking about autoimmune diseases, let me tell you, you will find that most autoimmune diseases, there is links, and there research that backs this up. There is link between that disease and vitamin D deficiency. Multiple sclerosis, there is a strong link. Rheumatoid arthritis, strong link. Lupus, there's a strong link. And later on, I'm going to come back to see what is similar between multiple sclerosis, rheumatoid arthritis, lupus, and something else, and you will get a little better understanding as to why vitamin D deficiency could cause such an issue. So here, let's talk a little bit now about C19 and vitamin D deficiency, right? That's where we are. C19 and vitamin D deficiency. So follow me now. Research out there is showing this. According to the Journal of Endocrinological Investigation 2020, it's a study recently published looked at data from 42 hospitalized patients in Italy who had been diagnosed with acute respiratory failure due to C19. Vitamin D levels were measured for each patient. Now, follow this now. 81% of patients with acute respiratory failure due to C19 had vitamin D levels below 75 nanomoles per liter. And they also had, all of these individuals had severe, listen now, severe vitamin D deficiency. So here's what happened. You might see the research out there yourself as well, where they are showing now that vitamin D deficiency is a big problem for C19, whether in terms of mortality, whether in terms of the extent of the disease and its impact on the body, or in terms of recovery, or also in terms of whether you will have the disease or not, or how your body responds to the disease or to the virus, I should say. So here's another research now. Let me share this with you. This one is from Israel. Research examined data from individuals in Israel who were tested for C19 infected between February 1st and April 30 of 2020 to see if there was an association between low vitamin D levels and the risk of C19 infection and hospitalization. The data showed an almost 60% increased risk in C19 infection for individuals whose vitamin D level was below 75 nanomoles per liter, compared to individuals whose vitamin D level was 75 nanomoles or higher. So in other words, again, in Italy, in Israel, they are finding that one of the big things with C19 is individual with vitamin D deficiency. And not only that, the increased risk of infections and so on is higher when you are low in this in vitamin D. Vitamin D levels above 75. Now here are some good news. If your vitamin D level is above 75, what is going to happen is this. You will have less severe C19 and lower lymphocyte counts, which are the markers for mild and moderate cases. Here is another thing. You will have less acute inflammation, possibly resulting in reduced risk of cytokine storm. So what this is simply saying in layman's term is this. When your vitamin D level is high, if you happen to come down with C19, what's going to happen is that you have a lesser chance of having inflammation overload, which is another name they use to call a cytokine storm. So that is why when someone has this, they're finding now that increasing their vitamin D, and many of our doctors have recognized this and have been using this in their practice, in their health centers or wherever, and they are finding that it is having tremendous impact in helping their patients to recover. And that is the reason I said that being deficient also has a severe impact for diseases like multiple sclerosis, rheumatoid arthritis, and lupus, because they are inflammation related. So that is the reason I'm sharing with you now that what one wants to do is to ensure that they keep their vitamin D level up, so that in that way you can keep the ward off inflammation and keep the body in good health. Now here's the thing. Now. Those who have better levels of vitamin D, studies are showing that if they come down with C19, you have a 55% fewer deaths for those who have higher levels of vitamin D. This information is absolutely amazing. Now, the last one I will share with you, I did share this with you before, and this is from the Journal of Clinical Endocrinology and Metabolism. This was published in October last year. It says more than 80% of C19 patients at a hospital in Spain had vitamin D deficiency. There are studies not only in Italy, not only in Israel, not only in Spain, not only in Europe, but right here in Canada as well, and in the US, that is showing a similar thing. The research is astounding as to what is going on when it comes to this. Now, how will I know if my vitamin D level is low? Well, I'm glad you asked. Here is how you'll know. All you got to do is to do a simple test. ask your doctor to get your test done. It's a simple blood test. You go, you said, hey, doc, I want to get my vitamin D level check. And like I said, prepare that they might tell you they don't want to do it. One doctor told me, you don't need to do it. Everybody is deficient, but that wasn't good enough for me. I wanted to know what my level is. I didn't think I was low because I've been using and I've been, sharing this for years. But I just wanted to see where my level was at. And so I said, please check mine. He said, no, you don't need to do that. I said, please, I want to do it. And he obliged. Paid. At the time, it was probably around $35 to do it. I paid, did it at the lab, got my result. My results was good. Praise the Lord. But let me tell you, most people that I've worked with here and encouraged them to go and they did get the test, severe deficient. I've had persons who have come back to tell me that the doctor told them they didn't even see a trace of vitamin D in their blood. Now, or it was so low that they couldn't trace it. Now, here is what your level should look like. So when you do go and do a test, most lab results is going to show something like this. Anything from 75 nanomoles per liter to about 250, just about. That's about the average range you will get. Some labs differ for whatever reason, but that is what is considered normal. Now, here's what I want to share with you. Current research is showing that you don't want to be on the lower percentile. You want your vitamin D level to be a minimum of 100 nanomoles per liter and above. Not at 75, not at 80, not at 90, 100 and above. Let me tell you, if your vitamin D level is less than 70, your body is going to have a hard time absorbing calcium. What do I mean? In order for calcium to be absorbed, you need vitamin D and protein. If you're lacking in vitamin D and are deficient in that respect, let me tell you, you can take all the calcium there, you are going to have a problem. That calcium is not going to get to uptake as it really should. And I'll give you a quick experience here. There was a lady we worked with a couple of years ago. She had osteoporosis, osteopenia, and scoliosis. She was taking high doses of calcium for years, and her situation wasn't getting any better. Well, here's what happened. When we were in that area, we were in this church, we're doing a special program there, similar to what we're doing here for you. What ended up happening is this. We went ahead and we sat with this lady. She heard the presentation. We knew that she was vitamin D deficient because we had the report to look at. We said to her, here's what you do. Cut off, for now, of the high supplement of calcium that you're taking. We showed her step by step how she can increase her vitamin D intake. And once she did that, we showed her some natural things like the blackstrap molasses because she wasn't diabetic and she didn't have cancer. So we showed her how to use the blackstrap molasses, the sesame seed butter, which is called tahini. We showed her a few other things to do and how to change the lifestyle and increase the vitamin D. And let me tell you, as the lady kept on the lifestyle program, she just kept calling to give us a testimony of what happened. When the next time she did a bone density test, let me tell you, they told her they've never seen anything like that because now she was not having those issues with the osteoporosis. Let me tell you, this thing of vitamin D deficiency is no joke. It is a serious thing. Now, some persons will say, well, listen now, I don't want to go out in the sun. I don't want to get sunburned. So what do I do? I'm glad you asked. Here's what you can do. You want to protect yourself. Antioxidant is something that can help you. Now, you want to avoid getting sunburned, right? Definitely you want to avoid that. But there are some fruits and veggies that are protective. And I got a list here, like blueberries, blackberries, strawberries, raspberries. So let's put that in one category. Eat your berries. They're high in antioxidant. Your plums, your grapes, your oranges, your deep, let me put it in a nutshell. Your deep colored fruits and veggies are high in antioxidant. Eat these things will give you a protective edge against the negative effect of the sun. All right, we're almost at the end here. Now, vitamin D2, vitamin D3, which should I be taking? That's a question some people ask. Should I take a plant-based version or should I be taking something else? Now, here is the difference between the two. D2 is plant-based. D3 is animal-based. Which is the best to take? Now, some persons who subsist on a plant-based diet naturally will say, of course, D2, because I'm plant-based. I'm plant-based too. But here is the thing. When it comes to health, healing, and restoration, I want to let you know, you got to watch what's going on here. The best vitamin D to take is actually the D3. D3. D2 actually is a synthetic form of vitamin D that comes from a fungal steroid. A fungal steroid, okay? Which is a form of mold. And that one is synthetic, as mentioned earlier. D3 comes from lanolin. Oftentimes that's where it comes from. That's from the sheep's wool. Let me tell you, D3 is far superior to D2. In fact, studies show that once either form, D2, D3, enters the body, it needs to be converted. Remember, we talk about proper functioning liver, proper functioning kidney. So guess what? You know which one gets converted and uptakes even faster? D3. It is converted up to 500% faster than D2. So if you want to get your levels up, get a good D3 vitamin D to help you there. Can you have a toxic level of vitamin D? You bet you can. If your level goes over 350 nanomoles per liter and above, you could have a toxic level. Now, what does toxicity looks like? Frequent urination, fatigue, excessive thirst, confusion, muscle aches, nausea, vomiting, elevated calcium, kidney stones, or even kidney failure. So here is what happened. Can you get vitamin D toxicity from the sun alone? The answer is no. The body knows how to regulate that. But from a supplement, yes, you can. But here is the other thing. There is more people who are deficient in vitamin D than cases that have been reported with toxicity. So what am I trying to say? You want to use vitamin D in moderation with guided principles. And if you want to have some more information, you let me know. We can guide you as to how much you probably want to take. But here's the thing. You want to ensure that you take something to improve your health. Let me tell you, most times, the time in the year I get the most calls from people that, hey, I just need some help. I don't know what's happening with my health. It's anytime between December to about May, because those times of the year, you're not able to get enough sunlight to make vitamin D. And most persons don't realize that they need to take vitamin D. Now, what helps vitamin D to absorb? Here it is. Magnesium, vitamin K, zinc, boron, and vitamin A. But most important is the magnesium, the K, and the zinc. Now watch this now. One hand of pumpkin seed can give you the magnesium and the zinc that you need. So eat a handful of pumpkin seed daily is also phenomenal for your health. Vitamin A you can get from some of your green vegetables, or also some of your like your potatoes and so on. You could get it from that as well. So those are some nutrients that is very important to help vitamin D to be absorbed in the body. And finally, how much should I take? Now here is a safe guide as to the amount you can take. For adults, 5,000 international units is excellent to help you. 5,000 IU is excellent to help you. All right. Now, if you're going children between 5 and 10, just about 2,500 international units. Any child that is below 5, it is 35 units per pound per day, right? So that is how you do that. You calculate for children. The best way to know if you are deficient or if you are at a high level is to do the test. I hope this information was helpful for you here this evening. I think I'm just about out of time here. Now, if you want to know what type of vitamin D I use, you don't have to use the same. This one I use here, I hope you can see it if you can. If not, we could always send that to you. That is the one that I use, and I found it to be very effective over the years, and that can also be of great help to you as well. Well, I think I'm out of time, or maybe over time, I'm not even sure. But I want to thank you so much for joining us this evening as we talk about the missing ingredient for your health. Listen, let me tell you, think about it, talk to your doctor about it so that your doctor can say, hey, you know what? You are deficient. You need to take something. Find out where that is, where your level is at, so you can proactively do something so that you can ward off many of the diseases that can come as a result of vitamin D deficiency. Well, guess what? Tomorrow evening, when you come, we are going to tackle a topic here. We're going to put what we've been learning so far in practice, and we're going to demonstrate that how we can go about turning off the faucet, unplug the sink when it comes to a lifestyle disease called hypertension. Invite a friend. Looking forward to see you then. Have a wonderful evening.